begin the discussion. Welcome everybody. This is Doug McCall from the International School Health Network. My pleasure to be chairing these FRESH meetings, and I'm pleased to be welcoming members of the FRESH partnership as well as others invited to this open meeting. I'm hoping everybody can see the screen, which is a slide entitled Health and Life Skills Education. And I'm going to do a bit of a stop-start going through a couple of these slides, stopping for discussion at different points. And then we'll be able to pick up the notes. As the description shows there, we're going to be reviewing a memo on the work being done at the UN level to record or to monitor through Target 4.7 a number of subject areas or domains of learning, including, or actually not including, health and life skills education. And then take a quick look at a few other things that relate to that. So I'm just going to put this slide into a, is everybody seeing the full presentation slide? Lloyd, if you could just respond quickly, or are you seeing the slides on the side as well?
Seeing both. We're seeing both at this point.
Okay. I'm gonna go to slide presentation mode. There we go. Okay. So hopefully everybody's now seeing the full slide. Well, as I say, we'll do a bit of a start presentation. So welcome everybody, and this, as I said, this meeting is to look at health and life skills education in a couple of different ways. And as we've discovered in the work that we've been doing in the FRESH working group on health literacy, life skills, and social inclusion, although this has been a topic or a core component of much of our work over the many years that many of us on the line have been involved in, it actually is a bit of a mystery in certain ways, as in the subtitle there, that it's possibly been ignored or poorly understood by policymakers, researchers, and donors. So that's kind of one of the main messages that I'm hoping to leave with you. So the three discussion points I'm hoping we're going to look at is a discussion about how to monitoring of health and life skills education, with a little bit of a discussion about education and promoting health and personal and social development, HPSD, and then also clarifying a little bit what we've come to understand to be health and life skills education, or to use another term, personal and social and health education curricula. The second part will be a quick look at some concepts and the questions in the global fact-finding survey that we've been working on, and the related policy and curriculum document analysis, with a little bit of a look at some beginnings of how an international research network through the World Education Research Association will be starting to look at those documents. And the last little bit, and I hope we do get to it because they're important too, the regular business meeting of FRESH, I wanted to discuss the idea of doing a kind of a rapid fire exchange in each of these meetings to enhance that part of our meetings, and then a brief update on the work that we've started with a working group on inclusion. This slide is just trying to put this into context. The social role of schools is well understood, but less valued compared to some of the other roles of schools, such as intellectual development or vocational development, or the accreditation role of testing students and placing students. And then also, of course, the most important role, I think, is the custodial role. And that's been the custodial role includes school meals and those kinds of things, which is in many ways been the focus of the FRESH partnership over the years, because we've been often concerned with low resource countries. A framework that I'm going to suggest that you can use in thinking about this is a report from UNESCO back in 1996, the Delors report, and it has 4 pillars of learning, which was to know, to do, to be, and to live together. And that's an important kind of a framing thing that I think is useful for this discussion, or the broader discussion rather. In 2015, as part of the UN 2030 development goals, the world's educational leaders met. There's the Incheon Declaration and an ensuing framework for action. And the FRESH partnership was successful in getting included in that discussion the terms health and life skills. And so we were really pleased at the end of that session in 2015, hoping that it would be part of the ongoing framework for action to be it's realizing, of course, how difficult monitoring at the UN, at the global level is, and all the technical problems and the data gaps and the challenges in countries to collect data and all those resource issues. I think we can say that we're still not looking, or we're still waiting for a focus or including a focus on health and life skills education. And that's been a challenge, which I hope we can perhaps help the UN agencies and others to be able to look at that. And the group that's been doing that work is called the Technical Cooperation Committee Group. And there are links in these slides and in the document to take you to those many discussions that they've been having. So a quick definition of the education promoting health and personal and social development includes a number of subjects. The three subjects that we think are probably most important from our perspective are health and life skills education, home economics, and physical education. But it can also obviously be delivered in a number of other subject areas. And so those are described on the slide, and the criteria for that or the key point, I think, is that health and personal and social development is really at the core of the social role of the school, and that needs to be understood and acted upon, in our view. There is also in the third paragraph on that page a discussion of how extended education or extracurricular or co-curricular activities, school routines and rituals and so on outside of the classroom can help. And again, going back to low resource countries or countries that are affected by conflicts or disasters, often that kind of less formal learning is the primary delivery vehicle for education to promote health and personal and social development education, because putting together curricula is a challenge, and often when countries are low on resources or fighting through conflicts or disasters, they're working to establish some of the more traditional literacy and numeracy subject areas first. Here is and then this is where I wanted to sort of stop after I go through this slide. This is the current list of indicators under target 4.7. And they're on the screen. I'm sure many of you have worked with them before. The overall target is looking at the quality of education, what's offered. And then there are a number of sub indicators which are listed there. In my view, and it's been a struggle, and an understandable struggle for the TCG to bring all of this together in a coherent way. As I said before, there are huge gaps in data, there are definitional issues, there are basic research and data gathering issues and so on that are really challenging. And so I think we have to be patient as they struggle through the challenges that they face. Nevertheless, I think they've dropped out the term or any consideration of health and life skills education. Despite the Incheon Declaration and in 2015 and other factors, it was, for example, part of the Education for All framework, but somehow it seems to have slipped off the page. And there are documents, if you go through that memo, which is linked on the FRESH webinars page, or in the documents that I sent out to FRESH partners, there was at one point in time the inclusion of what they called health and wellness in the conversation, but it seems to have dropped out. And I think part of that reason, as I first understood it, was that if you look down to 4.7.4 and 4.7.5, there are global studies measuring global citizenship learning, and also knowledge in environmental science and geoscience. There are well-developed studies that have gone to many countries through the IEA. It's a group expert in measuring, but there is no equivalent to that in the health and life skills area. And so that's when I first read the materials back in April 2019. I thought that's why they declined to really get involved. And that underscored the work that we've been starting and doing in the Fresh Working Group, trying to flesh out what is to be learned in what we call health and life skills education, or personal and social health education. And those are so that's one, our suggestion essentially was to expand 4.7.1 to include health and personal and social development as a topic area in that 4.7.1. Another area that could work in a very similar way is 4.7.2. It's an indicator that is a bit different than the other indicators. It's looking at the percentage of schools that provide skills-based HIV and sexuality education. The argument there, of course, is that we can, sexuality education is most often delivered in a health education curriculum, and health education curriculum is really best placed with health and life skills education. And so we could build an argument to do something quite similar to 4.7.1, but the current plan within that group is that they're going to gather that data through the Education Management Information Systems, EMIS, which is a good way of doing it if EMIS systems were tracking this kinds of that issue effectively. But I think we can assume that unless it's changed over the last little bit, that EMIS systems are not able to provide much data for 4.7.2. If they're vastly improved, that could change. And the other areas that are on in the table are fairly straightforward. There's work developing human rights education, which has been a long-standing concern for the UN agencies. And more recently, under 4.7.6, there's been a discussion of trying to look at the breadth of skills that are needed, which is a bit of an opening for health and life skills education, because they are for, as you know, Education International and Brookings Institution have called for a broad set of learning opportunities. But right now they seem to be tracking and developing a kind of a generic set of competencies, which would be useful at this level. And it has been done by groups such as OECD, but it's just the beginning of that conversation within the TCG group. The last little bit on the slide, and I'll stop here for opening it up for the discussion, is that there are other indicators listed below that cover other types of learning, including early childhood development, technical vocational education, ICT skills, relative achievement of girls and students with disabilities and other minorities, and of course, literacy and numeracy. So they're all covered within goal number 4 in terms of the learning that should be monitored eventually through the process. But there is that, in my view, our view, a missing piece, which is health and life skills education. So I'll stop there and ask if there are questions. I'm not sure that I can answer all of them, and I'm hoping that people online will have more information than me if we need to add to it. So the last little piece, I'm sorry, is that it's my understanding that the TCG is working towards doing a survey of some sort, a questionnaire from UNESCO to all countries that will gather data under these targets. 4.7.1 being the major point of area, a major focus. And that will include a survey piece, which will look at what they called context. And there's a national context survey, and that will include data about how their curriculum is organized and so on. And so that's the latest, I think, and it's probably, it is most likely too late to get health and life skills education into that process. It's such a challenging process for them to work with. It's just not feasible in my, I think. But we can still, as I say later on, and as we can discuss later on, provide complementary work that could be bringing that data into this conversation at a later date. So maybe open it up for comments and questions, and take our time with looking at this slide. Uh, Christophe, do you want to jump right in?
Yes, so it's not a question. It's just to give you a bit of background because I happen to be involved in the work with the TCG a few years ago, and actually I led the working group who was providing defined the 472. So just to provide you a bit of background from inside, well, I'm not sure it's inside because it's a very complex process. The TCG, as you mentioned, is really member states. The member states at the very beginning expressed requests in terms of what should be measured. And then there were a series of working groups that were set up based on expertise and I was in a meeting and I said, okay, well, I'm from the health and education section at UNESCO. We work on sexuality education. I volunteer to propose something because at the beginning, the problem is that there were no definitions besides these titles. And sometimes the titles didn't make much sense. They were obviously at the very beginning, nothing in terms of how the data could be collected. We only had some recommendations in terms of how the indicators or the definition should come up. It should be based on technical merit and also on the number of countries able to collect the data. So that was like the kind of guidance we received. So that just to give you a bit of background. Then also what I can explain is that when I was involved in this process a few years ago, what we were told is that it was not possible to add any additional indicators, and that the process was to basically come up with definitions, test the indicators, or say check whether enough countries will be able to collect the data. And my understanding is that now the TCG is actually kind of assessing these different indicators, the definitions, and is more in terms of now looking at what indicators should be dropped because if not enough countries collect the data, it means that the indicator is considered as not a reliable indicator for the year SDG, especially because there are only 9 years left now. So that's just a bit of background in terms of to inform like this thinking we have now in terms of what exactly we can recommend, what exactly we can do, because we have to take into consideration the process. You know that my colleagues from the UIS are the secretariat. Sometimes we talk to each other, but I haven't been really involved in the last discussions with the UIS. But I know that at this stage, it's not like there's a room for lots of suggestions, changes, and I would say definitely not new or additional indicators because it's not like part of the process. So that's what I can bring, kind of the experience I had. And in terms of 472, that was very difficult because we had this that was in the list of indicators without any proper definition. We just knew that countries should collect data on life skills and sexuality education. So we tried to come up with a definition that was based on the work that UNESCO had done, especially because we developed an M&E framework like 10 years ago for education sector responses to HIV. And some of these indicators had been piloted in a number of countries, especially in East and Southern Africa. And there was a commitment from many countries in East and Southern Africa to include indicators into the EMIS, which is why with, for example, the EMIS is recommended as the two data sources for this indicator. There's another data source, which is the annual UIS survey for formal education. But it was really tricky to come up with data sources. And as you pointed out, actually, there are not so many countries who included this indicator into the MIS, which is a major challenge for us, and which is a reason why the indicator may be dropped by the TCG if they decide that not enough countries are collecting data for this indicator. That's it. Over.
Okay, thank you, Christophe, and really appreciate that background and underlining the challenges that the TCG and UIS are facing. The huge data gaps within countries and resource gaps that work on that. Martin, I see that you're online. I don't. Your colleagues, one of your colleagues, is sitting on the TCG. Is there any observations or comments that you can make, Martin Henry from Education International?
Yeah, I'm actually not sitting on that committee myself, Doug, as you're aware. So I know there's been some arm wrestling, shall we say, about the attempts to limit or otherwise the scope, and we continue to have breadth of learning concerns, which we've been discussing. I do think you're right to keep your eye on this group and see exactly what is going to come out the other side in terms of the spirit and the letter of the law, as it were. And it would be good for us to remain vigilant on this topic. I'm sorry I can't be more helpful.
Okay, well, I think my assumptions about where they're at, and with Christophe's comments, it may be, and it's not anybody's fault or blame. It's really because of, in terms of if the indicator set is shrinking, it's because of the lack of data in the countries. But if they chose to narrow even further because data is available, that's the wrong way to develop an indicator system, that you go to what can be measured easily or what has been measured in the past rather than what you want to measure. Further comments and questions, just this Zoom format, if you could just click on the little hand sign to put up your hand so I know that you're indicating to speak, or just click on your mic and say hello, and we'll just deal with comments or questions. Okay.
Hi, Doug. Could I come in there?
It's sure. Paul, go ahead. Yeah. Hi, Paul. Yeah. Go ahead.
Yeah. Hi. My daughter's name is on this for some reason, but Paul Downs speaking. I just like to raise a few questions. So first of all, at European Commission level, we have sort of looked at recent research in the past decade on social emotional education, and there are quite compelling, international meta-analyses looking at the benefits of social and emotional education. And so I suppose the hope would be that so certainly at European Commission level, there's now a new EU key competence called personal, social, and learning to learn that developed in the last 2 years. And so the personal and social part is a new development. So the European Commission has absorbed the lessons of research over the past decade to bring this on board. So I suppose that the hope would be, perhaps for these indicators, if some are going to be dropped, there might be a flux for something to be added, such as the personal and social dimension, because certainly the research does point to a wide range of benefits on the curriculum. I just make one other further point, Doug.
Sorry, Paul, just a moment. If people could keep your mic off if you're not speaking, because there's background noise. Paul, go ahead.
I'm just wondering, is there much mileage under 4.7 of promotion of a culture of peace and non-violence, that perhaps that could be used as a heading to extend the personal and social dimensions, or the social emotional education dimensions, because a lot of social emotional education, pertains to, cooperation, to conflict resolution, to awareness of others. So it may be that heading could be extended or made more explicit around a social emotional education agenda.
That's a nice segue to move into a little bit of a broader discussion. That could be a hook, or in fact, there seemed also under 4.7.6 could be a hook there. But I have been observing that a number of the UN agencies are really taking a much stronger interest in life skills education and health and personal social development education more generally recently. The Global Partnership for Education, and Stuart, if you're online, if you want to, did a recent paper on life skills and social emotional learning and 21st century learning. They did a paper. WHO has just put out about a handbook on life skills. UNESCO, I know, is investigating social emotional learning. So there's a number of new initiatives looking at this, and I think the impetus for looking more at the social role of school is really strong. I was looking over the work being done at the UN level to respond to the COVID crisis, which is really looking at the not only the economic but the social and mental health issues that are arising in schools. There is a willingness to transform education that would be more encompassing. There is a UNESCO Futures of Education Commission that's looking into this. So there's a lot of policy opportunities or policy space now that we could benefit from in moving into in promoting health and life skills education more generally. But at the same time, I think, and this is, I'll move on to the slides. This is the history. I'm going to come back to this in terms of recommendations at the end of the discussion, but those are in the documents. These are recommendations that we begin the process to try to focus on this. But one of the reasons we formed, Fresh Partners formed a group on health and personal and social development education is that it's not really well defined. It's well defined by topic, by specific issues, be it bullying or nutrition education or whatever, but to all the different pieces that go into a generic set of skills for health and life skills education, that's not been well articulated. And so this diagram here reflects the various elements with the core curriculum in the center, the UN goals around in the colored ring, and the different forms of education, extended education on the outside. It gives a bit of a broadness to the scope, and that breadth of scope, it makes it challenging to move decision makers to look at doing this in a coherent fashion. Just going to spend a moment on this diagram, this confusing diagram. If you look at the little sunset in the middle there, the early childhood, primary, and secondary, these are domains of education that were, it's a modification of some work that was done by, through the TCG process of looking at the domains of learning. And if you look over on the left-hand side, health and well-being and personal, social, and emotional development are there as two of the kinds of domains. If you move outside that initial circle and you can see the different other domains, you can see how quickly curricula, core curricula gets crowded.
I need to work on that. I'm not gonna.
So those are it's just a quick look at the domains of learning, and it's a version that's quite similar to that started the conversation within the TCG. The little bubbles above that are a number of what we call learning and behavior models, which are well published and in many cases quite well developed in terms of concepts. And they are several, life skills being one, social emotional learning, critical thinking, resilience. So you can just look through the different concepts that are bubbles above that. So there's about 20, 25 of those bubbles that are often used in discussing education and are often seen as things that should be jammed into the domains of learning and eventually into the subjects, into the core subjects, or not jammed, incorporated into. The challenge in my view is they're often seen as floating outside the reality of schools, which is classroom instruction. And so that's a comment perhaps on the side, but you can see again the number of competing ideas or learning behavior models that are out there. And then the top learning to be, learning to know, learning to do, and learning to live together is from the Dolores Commission that I referred to earlier. I've reversed the order. Learning to be is often the forgotten cousin. Learning to know, learning to do, and sometimes learning to live together are often considered, but learning to be well, to be healthy, to be honest, to be in good relationships and so on. The learning to be part is often undervalued and not necessarily followed. And the little HPSD and Education for Sustainable Development, Global Citizenship, they are seen as overarching concepts that can organize all of this confusion below. And so it's I think, and then at the very bottom, you see a number of learning, sort of behavioral and learning theories, which are often used
I need to get this out.
to cover all this. So keeping
me.
that in
I
mind,
mean, that sounds surprising.
sorry, can whoever's
It
you
could
just
be a
make sure
currency conversion issue, but it puts it at like 60.
can you just make sure your mic's off, please, everybody? And then raise your hand when we want to move forward. So here's our attempt to try to deal with some of the lack of clarity. So we've tried to define education to promote health, personal and social development, and also tried to define what we mean by health and life skills education or personal and social health education. And so that's the definition there. It's an attempt to bring some clarity to a sometimes confusing world that is often seen as competing with the various topics, be it nutrition education or social emotional learning or sex ed or whatever, all the different topics, the 25 or 30 topics that are addressed within health and life skills education. And so that's another challenge. But again, trying to create some clarity about the terms that we're using. And I'll just so that's sort of the conceptual confusion that I think needs to be considered as we work through this. Christophe has noted that in the beginning, when TCG was doing a work, they started with titles and are working on those definitions. And if you have the time to read through the TCG documents, you can see that they've been trying to do that clarifying work for some time. So maybe just stop with that last slide and see if there's anything in that mess that is jumping off the page that you're saying, no, that doesn't really make sense to me, or is that the kind of universe of ideas and concepts that we're working with in this area? Okay, I'm going to leave that as being enough for now. We don't have the time to really delve into it, but if you've been doing work on any of those areas, please make sure that you can send it to me, and I'll make sure it's part of the process moving forward. So going back to the comments earlier, there is not really a good opportunity to insert this consideration into the TCG process at this point, as we've understood the data gaps and the challenges. But we do need to think, I think we do need to try to keep this on the agenda. So the recommendations that I noted earlier in the slides, I'd like to come back to, because by making the point, we can work on the next opportunity. You know, it's like in basketball games, you yell at the referee because you're working on the next call. And so that's maybe what we can think about doing for this process, is to make the point that health and life skills education, which is in the 2015 framework, has not really been addressed yet and needs to be addressed. And there are sympathetic ears within the senior levels of UNESCO and also in many of the UN agencies as well as within the broader field. So I think what we need to do is to get greater clarity about what we're talking about. There are some challenges that are there that are outside of the couple of questions I'm going to pose. And one of them is that our field, health education or life skills education, has always been driven by specific issues. So we have really good work that's been done on a number of specific issues with good evaluations of whether nutrition education or sex education or substance abuse education or a variety of bullying education or whatever, all those kinds of things where standalone pieces of a curriculum or instructional programs really have been tested and found that they can help students learn some knowledge, learn a little bit about attitudes, and be at the threshold of behavior change. The behavior change is not really strongly reflected in the literature, but getting to the level where students can plan behavioral change and behavioral intentions is pretty clear, at least for a couple of years after those kinds of programs. So we have good specific information, which we've rolled up into advocacy and documents, much like the FRESH partnership, where we've called for skills-based health education, or a number of other groups have called for that core curriculum piece. And that's widely spread. The idea of those pieces can be built into a larger whole. But the evidence is really not there. If you look for what's the impact of a health and life skills education program, a curriculum, what I looked, the only thing I could find that was readily available in terms of evidence was going back to 1985 there was a school health education study done in the US with 30,000 students where a program of 50 hours had an impact. And so we need to have the research to back up our rhetoric is really what we need to do. And then coming to this slide, we need to look at how health and life skills education is delivered. And so in the fact-finding survey that I hope everybody's reasonably familiar with, which is just, we're going to be in the field very soon, this is the question trying to figure out what does exist. Because our essential reason for the survey and for asking this kind of a question was that if we can demonstrate to people at the global level who are monitoring this kind of stuff, that there is, yes, indeed, a core curriculum that might be called health and life skills education. It is different forms as illustrated in the slide, but it does exist. And we're hopeful that we're going to have the confirmation of that data, that basic fact, as one of the key findings of the fact-finding survey. When we look for data about that, the latest that we could find, this is a year or two when we were looking, was a 2007 status report done by UNICEF, which looked at curriculum, and about 80% of countries did have such a core curriculum. But that fact needs to be brought forward and updated. So this is a question looking at the status of health and life skills education and the different forms. And I'm hopeful that we're going to be able to document the different kinds of forms from the survey. And it's easy to go wrong. In the materials, or at least in the background papers, you'll find we refer to a similar study of only 16 countries that was done by OECD. It was really about physical education. And based on those 16 countries, the report says that the most effective and the most prevalent model used is a combination of health and physical education as a curriculum unit. Well, that's, I think, debatable on both points, but we need to have the facts. And so you can see that this is kind of putting together that basic fact-finding exercise. The other data point or data collection strategy is to look at documents, policy documents, curriculum documents, and guidance documents that are related to curricula. And so this is an example of, we did a search of about 20 countries, in mostly high resource countries around the world, to see what they had online. And this was the Manitoba version of it. If you, so we are sharpening this up, but we're looking at collecting documents that in that first column provide context in terms of the nature of the country and the nature of the school system. We're looking in the second column about policy and other documents that have an impact, and some of them are such as a Healthy Schools Plan or a Safe and Caring Schools approach or anti-racism policy. and so on. Or we look at the cross-curriculum documents or curriculum frameworks. We're looking at graduation requirements, how if there's a core competency or cross-curriculum competency document, and so on, those kinds of overarching documents, and then going into the different curricula, health and life skills education, or social studies, moral and religious education, and so on. And in the lower right-hand corner, there's also subjects and other supports that also look at. The reason that it's broader than what we might think about health and life skills education is that part of the process is that we'll be looking at how well curriculum documents and policy documents reflect the goal of social inclusion, as well as health and life skills. And so this is going to be a big task. These documents will all be posted in the UNESCO clearinghouse and cataloged and so on, and available for people to look at in terms of studies. So I'll maybe look at these two slides and see whether or not these two fact-finding strategies or questions are appropriate, and do they cover the waterfront enough that we can move forward on them. Silence being assent. Is that if there are is there any comments on that on these slides? You can see the materials and just send me emails and I'll be happy to follow up on them. Just give you a moment. And this is one of the processes coming out of the FRESH working group on health and life skills and social inclusion. Was health literacy, life skills, and social inclusion, was the formation of a group within the World Education Research Association. And we've just submitted a work plan to continue that IRN. And these are the two pieces that we're looking at in terms of the analysis of those documents and the process. The first point is doable. It's still a big task because we'll have all those documents to analyze. And so we're hoping to put together teams of researchers who will look at that, to look at whether all those different pieces in that messy diagram from earlier are working together to promote inclusion through the school system. And there's going to be a document analysis, and it's only about the intended outcomes, intended learning. It's not actually whether or not it's being delivered. But I think it will provide a really good analysis that will be complementary to the recent UNESCO 2020 Global Education Monitoring Report. So we're hoping to have several researchers take on this task, and they'll work on clarifying and refining that point there. But the documentation should be available to be able to do that kind of analysis. The second point is really challenging. And it's something the FRESH working group started with, and knowing that we were going to have to pass this along to others, but is to try to fill the gap of having a good set of generic student learning outcomes in health and life skills education that can be realistic, that are realistic for different contexts, low resource, high resource, and conflict affected, and that they're derived from generic skills, essential knowledge, and critical values, universal values that can be promoted. And there's there's organizations working on this. Paul referred to one, the work that's being done in the European Union on personal and social development, or personal and social education and learning how to learn. OECD's been doing some good work. And of course, eventually there will need to be banks of student tests and portfolio assignments that can be assessing student achievement in this. In my view, one of the challenges, one of the things we haven't been able to do, despite decades of work on health and life skills education, is to be able to say this is what needs to be essentially learned by the end of primary school or by the end of secondary school. In the same way that the IEA has been able to do that for math and science and for reading and for civics and so on, there is a gap in terms of our definition of what's achievable, realistically achievable, and then developing some realistic indicators. And so that's that's eventually that would be to come back to target 4.7, not 4.y of the UN goals if we do that homework. And so I'm hoping to be creating some interest here for people to become involved and to take over that kind of analysis, and to work through the materials, the data from the survey, as well as the documents from the document collection that will be available. Because there's lots of good stuff on topic specific learning, but there isn't that overview that is needed. And there are several statements of generic outputs. The US has its national standards. The UK has done some similar work. I'm sure the EU has those kinds of statements as well. So there is that kind of overarching frameworks, but they need to be boiled down to what's achievable. So I'm going to stop here, and I'm hoping Paul and Orkan are on the line. Maybe we had a brief discussion about this prior to this call. That challenge is very big, but it needs to be done. And so maybe comment about how that might be moving forward.
I might just come in there, Doug, if that's okay.
Yep, sure, go ahead. Yep.
All here. At the European Commission level, so the Joint Research Centre of the European Commission has recently developed an overarching framework for personal and social education. So that is available. Perhaps you might be able to circulate it, Doug, to the group, so you can see there was a lot of thought went into that. Just to note that there was agreement at the European Commission stakeholders, with the stakeholders as well as with the document itself, that this would be for formative assessment for learning, not summative assessment of learning. So I think there is a concern about a social control agenda where the state prescribes certain kinds of personalities that people have to absorb or be. That's a very heavy-handed prescriptive approach for this area, and so the European Commission is not endorsing a summative assessment agenda, but it's more the formative assessment agenda. I think there is a big discussion to be had, perhaps with our group or the group that you set up, regarding cultural differences. Cultural differences regarding these issues does need to be thrashed out and really discussed in a nuanced way, perhaps in a more nuanced fashion than some of the research literature. So, for example, there would be a concern, certainly in our reports for the European Commission, at how the OECD has prioritized extraversion over introversion, whereas there are many strong qualities to introversion that can also be recognized. And so that, and the originator of that term introversion, Carl Jung, would have emphasized how Eastern cultures may be more attuned to introversion. So there is a real concern with a kind of cultural bias or cultural colonization. So I don't think it's an insurmountable concern, but it is something that I think does need to be discussed.
Yes, and just to pick up on that, there is another really good source, and I should have mentioned it earlier, that UNICEF and the World Bank has done some really good work in the what they call the MENA region, the Mediterranean and Northern Africa region that has addressed some of these issues, and that issue of what kinds of assessment is being done and for what purposes. And certainly summative evaluation of students is really not something that we want to encourage in health and life skills education. However, being able to say that that kind of education is having an impact on health and life skills development overall, as at a population level, is valuable, and I think is needed if we're going to get the kind of to avoid this kind of gap in terms of health and life skills education in the next round, when the successor to the 2030 goals is developed, that we have a greater awareness of the need for a broad education that does include life skills and health. And so that's the homework that needs to be done. And again, through the research that reports I've read, it's not even a uniform thing that can be for countries. They have to make decisions about what kinds of assessments they do and what kinds of tools they'll use and what kinds of indicators they'll adapt, because this kind of learning, well, in fact, all learning is dependent upon context and is dependent upon the subject content in which you're delivering it. So that needs to be all worked out by experts. That's where it gets way above my pay grade in terms of academic expertise for this, but I think that's the challenge under that second point there, that we need to encourage someone to start working on, and that's addressing the gap, the underlying gap that has led to the difficulties of TCG being able to work on this effectively. A quick reminder of what the Fresh Working Group was working on. That's the sort of mandate that we worked on. And I'm going to just go back to the recommendations here and ask for comments on this. I know that some organizations online, obviously the UN agencies, are not in a position to advocate advocate explicitly by signing letters or endorsing letters. That's not what they do at the UN agency level, much like governments don't do, government departments, but advising about how to do that effectively. And we as partners that are able to send those kinds of letters can send the letters to the TCG to begin the process of filling in the gap around 4.7.1 or to expand the scope of 4.7.2. Those are two options. The latter one was raised as a possibility in my conversations with some of the staff at UIS, but they're both complicated pathways to follow. Again, I think the paradigm shift, which seems to be underway as a result of the COVID crisis, may provide a urgency to this that's never been there before. And certainly the long-term work that many of the UN agencies, as I said, are engaging with already in terms of life skills education and health education. There is a policy space that we can move into. And then being able to share the results of the work on the survey that we've been doing. I guess the other piece there in terms of being willing to work with the TCG or its little partner network, the Global Alliance to Monitor Learning, is another strategy. And then recommendation 2 and 3, that are really calling upon others, donor organizations, as well as UN agencies, that any further guidance or work in the area of topic specific things, and agencies and donor organizations have to always respond to specific problems. But if you look through the research that's actually done, they'll often look at an area like sex ed or substance abuse without going into whether or not that's actually covered in the core curriculum area. And there's only been a few studies that I've said that I've seen where you have the specific teaching and learning about that topic, but the assessments or the control group doesn't really state whether or not it's covered in the core curriculum. And that kind of work should help to build the core curriculum in health and life skills education as part of the process. And same thing with donor organizations with small demonstration projects, that they should be building the core component as well as dealing with the specific piece. And so those letters would try to get that kind of thinking more embedded in the funding and work that's being, the very good work, it's always very good work that's always done, but helping them to think about how the core component of health and life skills education can be strengthened each time they do a project. So those are the recommendations. Is there any, sorry, go ahead, Martin, jump right in.
Yeah, thanks, Doug. It's a difficult thing that we're trying to do in terms of work with the number of agencies that you got lined up and so on. I'm actually quite interested in how the pandemic has changed people's response, because it would seem to me that certainly the feedback we've been getting from teachers and about kids is that the need for sort of social emotional connection, the need for physical health, the need for well-being and understanding is greater now than ever. And surely it would be a time for governments to be recognizing this and highlighting this need. And it seems that there is quite a potential for a platform off that type of discussion. And I'm just not aware of where I've seen this strand developing. I know you've been chipping away, Doug, but there may have been others who have done this work as well. Should there not be an understanding and a realization that as we go back into schools and as people are working around this idea of learning loss, which I've been particularly troubled by, as if everybody has to run faster in an academic sense and forget about the loss of the whole self, which comes as a result of the sort of the digital world that we've all entered. I'm just interested in comments or thinking or where other people are on that as well. Thanks.
Okay, thank you. I'm going to just go through the list as I see it on my screen. Lloyd, and then Christoph, and then Emily.
Thanks, Doug. I really appreciated this analysis, and especially the comments of Emily and Christoph and Martin and Paul. From a 30,000-foot perspective, just looking down and hearing everything that's gone on this morning, I would think, one, that the indicators may only last for another 9 years, only another 9 years, but I think it'll go into the future. I think they're vital. This is what we're all about. And sometimes we create more complexity for ourselves when we develop indicators, forgetting that it's really two different phenomena. One is kind of the technical development. And I think just from your slides today, you show the complexity of what I would quickly call health and life skills education, or what we used to call in the old days, health education. I think there's some benefit for simplicity here when we show all the complexity of what is health and life skills education or health education. We confuse people by all the personal and social development. I think they're critical, but would it be feasible to say, okay, can we all call this, pick it, I'm not going to push one, health and life skills education. And here's what it includes. It includes all of these elements, but this is what we're trying to measure. And that's what, when you talk to people quickly, we all focus on, instead of us saying, okay, it's health literacy, it's personal and social development, because then you just lose the decision makers. So would it be feasible to recognize that this is not just a technical exercise in which we embrace complexity, but it's a political exercise which requires simplicity, that we need to boil this down? And to what extent could the Fresh Alliance, as we hope it would do, and as exemplified by this slide that you have up, could it help to bring people together and say, here's a quick definition of what we mean by health and life skills. It includes all this stuff. We're not admonishing it. And then just looking at 4.7.2, the percentages as an indicator, the percentage of schools that provide health and life skills education, period. Not if we need to politically to say, including HIV and sexuality education. But it's not HIV and sexuality education. It's a critical part of it, just as personal and social development is a critical part. But when we kind of focus only on the part and the technicality, I think we lose the ability to come together as people kind of advocating for this to be a critical measure of the SDGs. So let me leave it at that.
Thank you, Lloyd. Christoph?
Yes, yeah, thank you. So Christoph from UNESCO. So yes, just some very concrete comments or responses to your questions about these recommendations from the perspective of UNESCO. For the first one, as UNESCO, we wouldn't be able to endorse the letter to the chair of the TCG as it is now, for a couple of reasons. First of all, because it is the UIS who is the secretariat for the TCG. So they are kind of colleagues. And sometimes the letter is like a bit, I mean, I wouldn't say pushy, but I think that because we still have some questions about the process, our view is that we should first ask where we stand now in terms of whether it's possible to influence the definition of the indicators, to add indicators, etc. Because as we just have 9 years left for this, this agenda. I mean, obviously we need to work for the future as well, but our view is that it would be better to ask for advice and say, what can we do in terms of changing, influencing that and that indicator, instead of just saying this is what you have to do. I mean, as UNESCO, we can't do that through this letter and the way it is worded currently. On the second point, send a letter to UN agencies. Well, the thing is that we can't really write to ourselves, so we would need to find another mechanism, because I mean, there are some UN agencies amongst the fresh partners, so we would need just to find a different way to do it. I mean, we support this kind of initiative, but I mean, obviously UNESCO can't write to UNESCO. And then the third point, yes, we fully support this point in terms of doing advocacy with donors. So that's it from UNESCO. Thanks.
Thanks, Christophe. Emily?
Thank you, Doug, and thank you for the very thorough presentation. My first point, following on Paul's comments, I really feel that unfortunately in a way, but the COVID crisis and the light it has shed on the role of schools in supporting health and well-being of students and the psychological well-being more broadly, really has given a lot of impetus on the importance of this broader approach to education. So I feel, as you mentioned, Doug, that there's a big policy opportunity here, but that's already there in a way. And I think that should lead to tweak a little bit the narrative of the letter and the way we are framing things here. Because actually, as we've heard from colleagues, many agencies are already rethinking this issue. We heard about the European Union, you mentioned GPE, OECD, the UN agencies through the interagency group and the work on HPS have also been revisiting the way they are approaching those issues. And as you know, there's also interagency groups. The interagency group is also driving an agenda to put forward school health and nutrition, which includes the education component and a much comprehensive approach to it. And I also wanted to mention all the discussions around the futures of education that will lead to a report later this year, that in a way, it's the next iteration of the Delors report you mentioned. So inputting into these discussions might be absolutely critical, and there's been calls for inputs and papers. So perhaps that's something some of us could consider. But I guess the point I want to make here is that there's a big policy opportunity, but there's already a lot happening, and we should build, from my perspective, a more positive story and building and acknowledging these efforts. On Lloyd's point, I couldn't agree more. I think these very thorough analysis and mapping are very useful for us as experts working in this area. But for advocacy purposes, simplicity is key, and for monitoring as well. So the next step is probably try to simplify and see what really we want to first advocate for in simple terms, and secondly measure. And I think the proposal of Lloyd seemed very sensible and something we could further work on, but putting all the complexity out there doesn't help for advocacy purposes very often. So perhaps something to give a thought to. As some of you might have heard already, in UNESCO, we are starting some work around a status report on school health and nutrition that builds on the FRESH framework, so it will cover education components. The status report really aims to take stock of what's happening. So first of all, take stock of the data being collected and available. So we hope this mapping we are trying to do on the data available will also help inform this discussion, and with the evidence allowed to input into the discussions towards sustainable development goals and targets. So it's all part of the same effort. And then regarding the recommendations, a little bit in line with what Christophe said about UN agencies not being able to write to themselves, I think it would be useful to have some clarity on who are the FRESH partners. I had a look at the website, and the list that's out there dates from 2016. And I think that if we want to do some joint advocacy and sign letters, etc., it would be useful to get clarity of who's driving the efforts and who's behind the FRESH partnerships, and being able to have more clarity around that. And I feel that for recommendation 2, particularly, as you know, Doug, we have this interagency group working already on school health and nutrition among UN agencies. So that might be the best entry point. And my sense is that we have already been looking into this, and the HPS efforts in particular are trying to frame a more comprehensive whole school approach to health promotion, including education and health literacy component within a broader perspective. So perhaps build on this effort and have a more targeted advocacy strategy might be more powerful. Thank you.
Okay, thank you. All good advice. Further comments? I'm just making sure. Does anybody else have a comment or a question before we sort of go towards closure? And I'll do a little bit of a summary. Anybody? I'm looking for hands up, I think. Okay, so let's, yeah, and all the advice from Lloyd and Christophe and Emily are very, very good. And maybe a little clarification of the FRESH partnership as I understand it, and it's evolving into more of a network than its original formation, which was back in 2000, was really a committee of UN agencies. And gradually over the years, it's evolved to include both individuals and various networks and various research centers and so on. And so my experience with networks is that when a letter is sent, the best way of doing it, and it avoids the problem of UN agencies writing to themselves, is a draft letter as described and discussed here would be developed, and those who can support it can sign on to that specific letter. That's how we did it when we advocated in the Education for All, for the Incheon Declaration. People signed on to the letter, and then it was taken forward, in that case by Education International, into that meeting. And so that would be, I think, in my view, the easiest way, rather than trying to develop and confirm a decision-making process with organizations and individuals that have different backgrounds and different standards or different protocols about that kind of advocacy work. And so that would be, I think, an important piece. And the second piece about advocacy based on, well, my experience is that advocacy is best done quietly and positively. And as Christophe has suggested, making sure we have our facts correct. I'm pretty sure that that's the status as we've just understood it of 4.7 right now is fairly clear, but we need to contact the people who are closer to that, and that would be both Menno, his last name has escaped me, who is responsible for the Global Education Monitoring Report, and colleagues at UIS, to just see if we've understood all those documents correctly. And Martin and I have talked about having his colleague who sits on the TCG to be able to give us greater clarity as well. But again, the approach is always to be helpful rather than to be critical, because given the complexities and the challenges of this, on the ground as well as in at a conceptual level is there's no blame to be assigned. There's only work to be done. And so that's the kind of approach we'll have, I'm suggesting we take. So it would be a once we've assumed the facts and had those conversations, sending a letter that people can sign on to or advise quietly and about the wording, but not sign on to. Another way of doing it to make sure that our point is being the consensus points we're making are clearly communicated and well received, and that's kind of the Fresh, as I say, is evolved into a network, and not only in terms of policy, but in terms of various projects. It spins off different groups that can take on more specific tasks or more specific activities. And so I'm going to use that as a segue to go to the last slide on this page, if I can get the slides to move. Yeah, there we go. Oops. One of the spin-offs has been from the discussions we've been having is to form a working group on inclusion, which is really following up on the GEM 2020 report. And so we've have some fresh faces from organizations that have been at the table for a while, as well as new organizations who have joined our little list. And and that's another invitation to follow up. And in the materials out to the Fresh meeting, and I'll make sure they're posted on the Fresh webinars page, there's going to be a series of webinars and some other activities on inclusion as a theme, following up on the GEM 2020 report. There are colleagues within UNESCO who are work on the GEM 2020 report that are involved, and other organizations. And so that's another area that people might want to be interested in. It's not advocacy, but it's some knowledge sharing that would be very useful. Inclusion International is one of them. We've never really had a representation from the communities, the community and the organizations that represent students with disabilities. I think that's a welcome change, as well as a couple of other donor organizations and others that are interested in that issue. So that's kind of the modus operandi that I'm suggesting for this network, as it seems to have worked in my experience over the years. And then the advocacy letter would be done carefully. The last point I'm going to go to is looking at the idea of doing a kind of a rapid fire exchange where people have a chance in these meetings to simply alert others about what they're doing that they think would be of interest. And the process I'm suggesting is that we do a pre-meeting email exchange. I put them all together into an email, and we simply run through that list online and give people a chance to say a couple of words so that the people have a background to it. And it would be a rapid fire exchange of what's going on every 2 months. That need not be just Fresh partners, global organizations who might have a global initiative, or but the criteria would be a global initiative, and allow people just to quickly exchange, and web links would be really important to follow up on. People,
Exercise yesterday, I didn't do today.
Sorry, yeah, somebody's, you need to turn off your mic if you're not dealing with this conversation. So I'm asking for feedback about that kind of rapid review of what's going on every 2 months. Are folks comfortable with that? And any suggestions about doing that specifically, you can raise now, or you can send me an email to that effect. I've had some positive feedback from people already that seem to like that idea.
Good idea, Doug. And also, I'd just add to that, might be good to get a CIES plan going. I don't know if we've got anything organized for this year, but it's not a bad setting for putting out some of these messages as well.
Oh, right. So yeah, it must be going towards a virtual conference, do you think? It must be, eh?
Yeah, it's definitely virtual.
Okay. I'll take a look into that.
I'm dutifully muting here, Doug.
One of the pleasures of the work on inclusion is that other members of that small group have agreed to take on a leadership role. And so all leaders welcome on things like that. If people can just say, okay, my contribution to this Fresh network or partnership is that I'll take on a little piece. That would be really good. So anytime folks want to step in and take a piece, then that would be great to follow up on. As I get older, I get tireder. All right. Further comments? Thank you for about this. Anything last advice about the topic of health and life skills education? Thank you very much for your feedback and information, and we'll be in touch by email. The next meeting is 2 months away, and it's I've moved it, as you may have noticed, to the first Tuesday of that month, rather than the last Tuesday of the preceding month. So the dates would be. I'll put them out and send. I'm going to learn how to do a calendar invitation as well.
Thanks, Doug, and we appreciate all your work. Keep at it.
Okay. It's always fun. All right. Thanks again, folks. I'm just going to pause.
Thank
Thanks,
you.
Doug.
Yeah.
Thank you,
Thank
Doug.
you.
Thanks.
Thank you, Doug. Thank you.
Okay. Okay. Take care.
Bye-bye, y'all.